Good morning and welcome to another edition of Our Town here on 94.9 and 99.1 The River. My name is Darren Swinson. Our Town, as always, brought to you by Decorah Bank and Trust. This week is National Hospital Week, and we are going to be talking to the two heads of the hospitals in our immediate area. A little later on in the program, we will talk to Steve Slessor. He is the Chief Administrative Officer of Winneshiek Medical Center in Decorah. But we'll kick off our conversations with the CEO of Veterans Memorial Hospital in Waukon, Micheal Coyle. Those will be our two guests this morning on Our Town on 94.9 and 99.1 The River. This week is National Hospital Week, and we catch up with the head of Veterans Memorial Hospital in Waukon, Mr. Micheal Coyle. We haven't touched base with you in a while, but the perfect week to do it, Micheal. And as we look at National Hospital Week itself, how important is it to a local community to have a vibrant healthcare provider in their community?
Well, I think it's always important for healthcare, Darren. You know, what we found, especially during COVID, was small hospitals, critical access hospitals, smaller community hospitals were kind of looked at like a Band-Aid station, right? So if I need something major, I'm just going to go to the big hospitals and, you know, the tertiary care centers. But what we found through COVID and now even post-COVID is those beds were all full. And so the small hospital had to learn how to take care of those much more sick patients, how to handle the patients that we would have normally transferred out. That required our nursing staff, provider staff, other direct care staff to really step up their game and do a better job of treating patients. And since then, now people just want to stay local. And that is huge for us because over the last couple of years, we've seen our market share grow every single month. Areas like surgery and our primary care clinics here and in Postville, emergency room, all those areas continue to grow every single month. And that's a couple things. One, people are just choosing to stay local, which is awesome, but they have confidence in the care of you know, critical access hospitals to get the treatments that they, you know, that they need to stay healthy. So it's been phenomenal for us to, you know, to see that support from our communities.
And how do you go about establishing that trust with your community, knowing the fact that you don't have to travel 70 to 100 miles? You can get the care right here in Alameda County.
Well, it really comes down to outcomes. So, you know, our new mantra here at VMH is our family caring for your family. And that's truly what it is. You know, there's something about when you're not feeling great, when you're in a high stress situation, a family member is really sick, and you come in and you see somebody you know, somebody you can trust, somebody that you have a personal relationship, you're going to feel better about the overall care. And again, going back to the skill sets that we have, COVID really made us get better at what we do. So not only do we have that family caring for family attitude, but we've got the skill set and we have the outcomes that will match the large tertiary centers. So, you know, our goal is that when you leave VMH, you're a lot healthier than when you got here. And what we're finding out when we see what our quality scores are and our quality outputs, that's exactly what's happening.
And obviously, COVID was an unprecedented situation for everybody, and healthcare was at the top of that list. But is it a case of when you deal with something like COVID-19, if you don't learn from it and get better from it, you're probably not doing your job?
Well, and take a look at the hospitals that have closed around the country. Not only hospitals, but nursing homes and physician practices, long-term care facilities. Those folks have closed because they didn't know how to respond. And what's great about VMH is we're an independent organization. We're not managed or owned by any large entity. So the ability to stay nimble and react very quickly has been a huge advantage for us here at VMH, especially during COVID. And now we're kind of thinking past COVID, but how do we continue to evolve on a daily basis? And I think when you're in a large institution, sometimes you think about, yet there's so many levels of bureaucracy and everything else you've got to do before you can make a change that is either in the best interest of the organization, the employees, or the patient. What's great about being an independent facility our size is once we figure out this is going to be a great change, we can just move forward. And I think folks respect that, and they've been responding to that very well by choosing us over our competitors.
And the biggest change over the last year was probably are more behind the scenes things than the direct patient-to-patient care. But how has that transition gone? Where is it in the process? Is there still more things to do, or is it fully complete?
Well, the patient, folks in the community, they have not seen anything from a care standpoint. It has been absolutely seamless. And I think that's a very important process. We never wanted to put any of the burden upon the patients. We just want them to come in, get the best care possible, and move on. Matter of fact, most of my staff, they couldn't even tell you if there was a change. Really, it's been behind the scenes on the administrative side, working with the city and the county to make sure that, assets gets transferred and insurances get taken care of, like on the building and those type of things. Just making sure all the I's are dotted and T's are crossed. From a care standpoint, from an employee standpoint, nothing has changed. And that's really important because we offered amazing care before the transition, and we continue to do it now after the transition. There are a few things that we still have to do with some of the property that's on the campus here. But again, the average Joe will never know what that is.
I know one change you also saw was the addition of the outpatient clinic in Postville that opened up last year. How has that been received?
Well, we opened that in July of 2022. We have Micheal Creary over there, and we have Dr. Tom McMullen over there. And then we have other folks like Tara Fink, who's our behavioral provider, goes over there. Our midwife, Katie Maker, goes over there. And so we're really starting now to ramp up not only primary care, but some of that specialty care that folks are looking for, the midwifery program, the behavioral mental health programs. So you combine that with primary care, and we're starting to really cut through folks over there. Now, obviously, it's a different culture in Postville than it is in Waukon. So it's taken us a little while to truly understand that. But what's really nice, the summer's coming. We're involved in a lot of different activities, farmers markets. We're doing blood pressure checks. We're at the schools. We're anywhere you need us to be, and that's really helped our numbers. And folks are just getting used to our providers. They know Dr. Tom for the last 40 years, but they have to get used to some of our other associate staff, our nurse practitioners and PAs, and that's going really well. And we're starting to see folks from the West Union area and some of those other surrounding areas coming to Postville that normally weren't coming to Postville before, but they understand the quality of care when you get to VMH.
As you look into both the short-term and the long-term future of your facility, what services do you see being added at this present time?
Well, we're going to continue to add more providers in our medical clinic. We have a lot of nurse practitioners, physicians, assistants between the Gunderson Clinic, the Waukon Clinic, and the Postville Clinic. So we're actively recruiting other physicians because you still need physicians to run a really good health system. So we have a couple of those folks that we're recruiting. I know Gunderson is recruiting another physician there as well. And so that's key to us. Then, of course, it's specialty care. So we just launched our new our hospital pharmacy, our internal pharmacy. Now, this isn't a retail pharmacy, but it's an internal pharmacy that supports all of our departments. We moved that from the basement to the main level, and we added a chemo suite in there so we can start getting back into the chemotherapy program in the near future. Couple of other areas, we will continue to expand our behavioral mental health programs. So in 2024, Medicare changed the rules a little bit, and they allow us to have family counselors as billable providers in the rural health clinic and our medical clinic. That hasn't been that way until now. So that will provide more opportunities for counseling, both individually, family counseling to happen in there, paired with Tara's ability to prescribe meds for those folks that need medication. So that's an area that we want to expand upon. And then other specialties that really we want to take a look at include, GYN or gynecology. We want to see additional orthopedics done here, ENT or ears, nose, and throat providers. Those are the folks that keep our patients local, and they're procedures that we can easily do here at VMH. So those are the areas that we're really concentrating over the next probably 12 to 24 months.
And from what I understand, as of right now, you have suspended your urgent care for the summer months. Explain what all that entails, and if persons have that urgent need for healthcare, what are their options right now?
Well, during the summer, we find that our urgent care numbers just simply go down. And by the time that we try to find staffing, all the providers and nurses that we use in urgent care are current employees in other parts of our hospital. And most of them during the winter, fall, and spring months, it's not a big deal to pull extra shifts. But during the summer, they choose not to. And so that's one reason. And then you take a look at the decline of volume. So you got to have enough volume to keep those things open over the summer. And we see a dramatic decrease of volume from this time to the beginning of September. Our plan is we'll reopen that again September 9th, that first Saturday of September, which will precede the normal flu and pulmonary issue season. And we keep it open until the spring. Meanwhile, what we do in our medical clinics is, we ramp up the ability for same day care. And quite frankly, to go either to the Postville Clinic or the walk-on clinic is much less expensive than going to urgent care, which is much less expensive than going to the emergency room. But we remind folks, we're open early on Mondays in walk-on. We're open late on Thursdays in walk-on. We always have a provider that is set time aside for walk-in appointments so we can get in on the same day. That's very important. And then, of course, we still have the emergency room for those, those really hard times or large needs that you have. And that's 24/7. But we'll reopen that again in September, and we'll keep that open again until this time next year.
And I bring this up because I dealt with this personally just recently on the healthcare front. How important is it to have that primary care provider? Because I dealt with a situation where I ended up going to the emergency room, and I hadn't been checked out for quite some time. But how important is it to establish a primary care provider to make sure that we have a healthcare system and not a sick care system?
That's awesome. I use well care versus sick care. So same kind of philosophy. Again, the most expensive care for any patient is when you're sick. If we can keep you from getting sick, that's where we can save you time, money. We can save you vacation and sick days and a lot of heartache. Creating that relationship with a primary care provider is essential. A lot of people are like, well, I'm not going in, excuse me, unless I'm sick. The problem is it takes longer to get you healthy again. And that great relationship with your primary care provider can allow you to manage, early onset diabetes, early onset hypertension. We can catch those infections. We can catch those ailments before they become, debilitating for you, which is best for everybody. And a lot of people, have that mentality. I don't want to go in unless I'm sick, but then that's too late. We can keep you from being sick. And most importantly, we can keep you from spreading that sickness to other people. So we tell folks, build that relationship. And that's what we tell our providers in both of our clinics is take the time to get to know the patients, not only the patients, get to know their family, get to know things about them, because that's how you do whole care. And that's another reason why we decided to put our behavioral health clinic inside our rural health clinic, is because treating behavioral and mental health, both from the behavioral side and the medication and the total body care, is so important to have those things jive together, because we can do a better job of taking care of patients. So that integrated model is so important to us here at VMH. But again, build that relationship. The nice thing is we've got enough providers where if your primary care provider isn't available for whatever reason, we have another provider, and they talk routinely every single day about their patients. And what's great about our physicians they work with our associate staff routinely to make sure that we're giving the best care to our patients, and that they're getting the best knowledge from our providers, no matter who's taking care of them.
And a lot of that, the way you answered that question, steps into my next question. Since it is National Hospital Week, the staff at hospitals are a lot of the people that make everything flow at the hospital and develop that trust between the community, the patients, and the staff itself. I'll give you a chance to sell your staff here at Veterans Memorial Hospital. It's your dime. Spill it there.
All right. Well, Hospital Week is important because we need to recognize not just specific departments, but everybody. So, we spend all year and we'll have laboratory week, we'll have radiology week, we'll have, patient access week and nurses week. But this is the one time where we bring everybody together. So, we do a lot for our staff here. We really want it to be a family setting and not just a factory, treating people. And so this morning, the leadership made breakfast and we served the whole staff breakfast. Tomorrow we have a barbecue for our staff. But what's really cool is the ability for us to give back to the community during this period. So tomorrow from 3:30 to 6 is our annual family wellness fair. And we have over 40 different exhibitors on site here at VMH. And so this runs from 3:30 to 6 p.m. It's free and open to anybody who wants to come. And this year, we worked with the Be the Match Foundation, and it's a stem cell sampling program provided by the hospital lab. And this is the same program that Robin Roberts from Good Morning America endorses following her own struggle with bone marrow transplant match 10 years ago. So again, it's a free program where you can come in and we'll do some sampling and give you some results and hopefully not find anything, but if we do, you can take it to the next level. Our partners over in Gunderson, they're having a teddy bear clinic that night, and they're going to show some of the renovation that they just recently completed. But when you come on campus, you're going to start in the medical clinic. You'll kind of walk your way around the hospital, and you'll get to see all the services that we offer. You'll get to meet our specialists, our nurses, therapies, massage therapists, and pretty much everybody that has a service here. And you can really get to feel that family atmosphere while you're here on campus. Lots of door prizes, lots of gifts given. We're going to give those away. You're going to have an opportunity to stop at booths, collect some signatures, and get keys to health. And then at the end, you'll get a keychain and get entered into some great door prizes. The most important, why do we do this? We want you to see our facility. We have a beautiful clinic that we remodeled 2 years ago. We've put other renovations into our hospital. We've got some of the best state-of-the-art equipment you'll find in the region, hands down. And we probably have, and I know we do, we have some of the friendliest and most knowledgeable staff that you'll see. And you'll really start to feel that connection about why people are starting to choose VMH over all the rest of the competitors in the region. But it all starts with, again, our people. So come on in tomorrow, spend some time, do a little walkabout, get to see what we have to offer, get to talk to the people who will be taking care of you when you get here. And again, that's all free. And it's tomorrow, Wednesday, from 3:30 to 6 p.m. here on campus. So, I just got to give a shout out to all of our staff. We just did our patient engagement, and that's the patient satisfaction scores. And in our medical clinic, we're ranked in the top 3% in the country, which is, it's awesome. But even better than that is the scoring that we get for our inpatients and the scoring we get from our emergency room. Those scores are all in the top 2% in the country for overall patient satisfaction, for what they feel that their perceptions of the care that they got and the actual outcomes that they got here. You're not going to see that in a hospital around here, except for right here at VMH.
Anything we're missing? I think we've covered quite a few things, but there's always more things to add, I'm sure. Michael, anything we're missing, as long as you got the forum?
Well, we have, just remember this Friday night, we have a band coming to Goodfellows, and it's a reunion band. There's 11 band members that are going to all come back to walk on. They're doing a free will donation. All those proceeds are going to go to the Healthcare Foundation, which gives money for scholarships and buys equipment for the hospital. And that will be at Goodfellas. And we had a really nice radio interview with those guys. They play everything from, 50s rock to, some oldies and goodies up to 90s rock and country and everything else in the middle. That will be at Goodfellas. And it's going to start about 5 or 6 o'clock and run till about, I think it's 10 o'clock. So please come to that. The other big event that we have, June 19th, the Monday after Father's Day, is our annual golf tournament that is also done by the foundation, and that will be here at the Waukon Country Club. So please keep your eyes out for those things. All those donations, all those things help us do our mission and make sure that we can, heal people when they come here to VMH.
Yeah, I believe my friend Bill Withers is part of that group that will be playing coming up on Friday night. And Bill's a terrific guy, always loyal to his hometown of Waukon, and has done many great things. And obviously is talented too. Michael, always good catching up with you and catching up with all the good stuff going on at Veterans Memorial Hospital. Happy National Hospital Week to you and your staff. And thank you for what you do to keep the area healthy.
Thank you very much. I just hope everybody comes out and sees the facility and spends some time with us.
Michael Coyle from Veterans Memorial Hospital. Get there. Steve Slessor is with us. He's from Winneshiek Medical Center as we continue our discussions with National Hospital Week going on. And Steve, in general, how important is a vibrant healthcare industry to a community as we talk about National Hospital Week?
Yeah, obviously, as you might expect, what my answer will be, it's incredibly important, and for a variety of reasons. Certainly, the work that our staff and our physicians do each and every day to serve the community in their time of greatest need at times is incredibly important. Also, the economic engine that a healthcare organization produces for a community, and especially for a rural community, is incredibly important. We remain one of the largest employers in Winneshiek County. And so both from the work that our staff do and the economic impact that our organization has, I think it's absolutely crucial to Winneshiek County, to the surrounding area, and to the city of Decorah, certainly. So we're thrilled to be here and be in the great position that we are to provide care and provide jobs.
And you look at over the last 20, 25 years, the level of care that you can get at Winneshiek Medical Center here locally as compared to going 70 to 100 miles to seek other options. How important has that growth been to what you just touched on?
Yeah, incredibly important. Our number of specialists and our number of staff continue to increase, and we are not done by a long shot. And so we've had great success in recruiting here recently, really over the last 3 months. A lot of exciting announcements. We are adding an allergist, a Mayo-trained allergist here in September. We have a new family practice physician starting in October. We signed a second full-time orthopedic surgeon, also Mayo-trained individual who will be starting with us in late August. We've signed a dermatologist that's going to start with us in 2025, and we're still actively recruiting for a few other specialists. We also, in the last 3 weeks, opened up our new comprehensive wound center. And so we have taken great strides in growth, which adds to the services that you can receive here without having to travel 70 miles. Again, made fantastic strides on that in the last few months, and our work is far from done as our recruiting efforts continue.
What do you credit that success in recruiting to Decorah to?
Yeah, so I think it's a few different things, and we talk about it a lot. If we can just get individuals to come visit us here, a lot of these physician recruits may never have heard of Decorah or this part of Northeast Iowa before. And what we've always said is if we can get them here, there's a good likelihood that we can sign them to want to be here. Our community is absolutely fantastic. This area of the state is beautiful. And so there's a lot about the people here and the community that we live on that are incredibly attractive. I mean, being able to say that we have one of the top 2 schools in the state year after year here in Decorah is certainly a big deal when we're recruiting a physician, especially one that has school-age children. But I also think that when physicians come and visit and look at the opportunity here, I think they're always really blown away by the amount of services and specialists that we have here. I mean, we have a group of 30 plus Mayo Clinic physicians here providing care. And when we tell them, hey, we have a full-time radiologist here, pathologist here, ENT, orthopedics, general surgery, I think it's just more than maybe what they expect when they look at Decorah on a map. And so when they come here, they interact with our fantastic community. They're able to interact with our healthcare organization that we feel provides a lot of excellent individuals, excellent physicians, and excellent care. As long as we can get them here, get them willing to spend the time to come here, we have a lot to offer in many different ways.
When you go about recruiting individuals to come to Winneshiek Medical Center, how does that process go? Do you establish a need and go from there? Do you establish just where vacancies would be? How does that process go?
Yeah. So we work with our partners, Mayo Clinic, on any new recruitment that we have and absolutely do ensure that we achieve their blessing to go out and recruit another Mayo Clinic physician. And, Mayo Clinic wants to ensure that their physicians are going to have good work to do when they're doing it. And so they want to see what those numbers are, what the need is. We look at what kind of services we're referring out. That's obviously a key metric. If we know that we're sending out a whole bunch of orthopedic cases, for example, then that's a pretty clear sign that orthopedic surgery could be very successful here. So we're looking at those metrics, working with our partners at Mayo. And then Mayo actually helps us do the recruitment. So they'll help us source candidates. And a big shout out here locally to Dr. Tom Marquardt, our Chief Medical Officer, I know you've talked to before, and Dave Rooney, our Operations Administrator. Those 2 individuals really take the lead on our physician recruitment efforts and have so for many years and have done a fantastic job of working with those candidates and really showcasing what we have to offer. But it is absolutely a partnership between Mayo Clinic and WMC in terms of establishing that need and in terms of the actual recruitment process to get the individual committed here.
And how important is that relationship with Mayo to get people to Winneshiek Medical Center?
Yeah, it's absolutely critical. So there is no doubt. So the couple of the 4 new physicians I listed, I would say 2 of them are predominantly, we probably wouldn't have had an opportunity for 2 of those 4 if it wasn't for that Mayo Clinic health system relationship. So whether it's somebody that's known by Mayo or they're training at Mayo and looking for an opportunity to stay within that system, or we've had outside individuals that have applied to our role and done so only because of that connection with Mayo. So it is absolutely key to our recruitment success, that Mayo partnership.
And we touch on that partnership. You have that relationship with Mayo, but decisions are still getting made at the local level, and the operation of the hospital is still at the local level. Describe that unique balance, because is that a rare thing in healthcare nowadays?
Yeah, to a certain extent it is. And it's really a great balance for us. So as you articulated, there are certain things like the recruitment of a Mayo physician, for example, that Mayo is absolutely going to have a huge say in, and that we have to go get that approval. A lot of the other items, though, are made here. Those decisions are made here locally and by our county elected board of trustees. So, Darren, you and I have talked in the past about that facility project that's still, very much in process. And that facility project is a project that ultimately will be presented by leadership and will be voted on by our 7-member elected county board of trustees. So there absolutely is great decision-making authority that resides here locally. But with that, we also retain that great partnership with Mayo. And we really find that to be a great balance for us. It's worked for us. We think it's working for Mayo, and so really all good positive vibes on that.
It was almost like you were looking at my crib notes. The facility project was the next thing I was going to ask you about it. Give us the update on where that is right now.
Yeah, you bet. So the design of that project is 99.9% complete. We're just asking a few final questions on those final construction documents. Our new CFO has been working on interim financing options and pretty close to landing where things are going to end up there. So right now, what we're anticipating is that project will go out for bid in early June. That bid process is roughly a 6-week process. So my anticipation is that by the board meeting in August, our normally scheduled board meeting, that this project will be on that agenda for hopefully approval, depending upon where bids come back. But we won't know exactly how that'll all look until we know where the numbers sit. But I would anticipate a pretty big announcement or pretty big board meeting coming up in early August.
And as you've gone through this process from the initial idea to where you're at right now, obviously borrowing money is a little bit more expensive now than it was when you first discussed this. How has that required maybe some adjustments in what this project will be?
Yeah, that's absolutely correct. So not just the interest rate, but also the construction expenses. So when we started talking about this project a year and a half ago, or really started to put initial plans down, the project was probably, not going to get the numbers exactly right, but was probably in the low 40s in terms of million, 41. Sitting closer to 48 now from a total project cost perspective. And so a lot of that's been, well, pretty much all of that has been driven by construction expenses increasing over that time period. And at the same time, as you referenced, those interest rates have been climbing up. Now, as we've talked about before, this project's funded in 3 different ways. It's funded in part by our own cash reserves, in large part by a low interest long-term USDA loan, and then also by loans from local banks. And so one fortunate thing is that, yes, while the USDA loan interest rate has increased, it has not increased to the same degree as overall interest rates have across the country. The USDA is a little bit slower to raise their rates and don't do so quite as rapidly. And so what was once a 2.5% interest rate from the USDA when we first started looking at that is now more like a 3.5% interest rate. And certainly that's impactful, that 1%, but it could be way worse in terms of that growth in that rate. And so in terms of adjustments to the project, we have looked at some what's called value engineering to the project, or there are some things that we can look to reduce a little bit of expense here and there, and probably have found some of those, but ultimately we won't find enough of that without really jeopardizing the integrity of the project to then really offset all of the cost increase. We're just not going to be able to do that. And so we just know that it's going to result in a little bit larger payment than what we initially had anticipated. And we'll just have to figure that out and make that work with our other priorities. But our main priority, as I think we've talked about before, is that WMC continues to grow. We've shown tremendous growth over the last couple of years with all the new recruitment that we're doing. We intend to continue to grow significantly, and that is how we intend to provide more local services and create a financially sustainable position for this organization.
And you touched on this. Part of the financing will come from local banks. Is that a message that perhaps you feel is being sent from your organization that, hey, you know what, we're doing good things for this community, so these community banks are very comfortable borrowing money to us? Is that a good sign, that symbiotic relationship?
Yeah, for sure. It's the USDA long-term low interest rate is just a super unique opportunity that rural hospitals have to capitalize on some of those dollars. And so absolutely, we're going to take advantage of that opportunity, and the local banks are supportive of that. But certainly we want to make sure that we are continuing to work with our local community partners. We've had a lot of meetings with the local banks here about helping to fund part of the project. I certainly believe that they're excited to be engaged with that project. We're excited to have them engaged with that project. And so it really is a great balance of being able to leverage some of those governmental programs that are unique to us, but also keep that great local partnership as well.
And of course, it's a National Hospital Week, and a big part of Winneshiek Medical Center is the staff and the people that interact on a daily basis with your patients. I'll give you the opportunity to talk up the folks that work there and how important they are in this process.
Yeah. So as I talk about in every new employee orientation, when we talk about our strategy, we can have the best strategic plans and the best brick and mortar, but if we don't have awesome staff doing great work every day, the rest of that stuff is absolutely irrelevant. So our number one focus has to be being able to retain, being able to recruit wonderful staff members, which is getting more and more difficult in healthcare. I've been here now. I'm just coming up to my end of my second year here, and I've been incredibly impressed by the caliber of the individuals here, from our physicians to our leaders to our frontline staff members. The professionalism, the clinical competence for those folks, the pride that they take in our organization is absolutely clear to me every day when we interact with those individuals. Hospital Week and Nurses Week, which also is going on now, provides that great and easy avenue to say thank you to those folks. We probably should be doing it even more than what some of these opportunities allow, and we try to do that. But Hospital Week gives us that opportunity to express, at least from our standpoint, how incredibly thankful we are to have the individuals that work here here. So. No, over my 2 years here, it has been an absolute blessing to be here and be surrounded by excellent individuals every day. I would feel nothing but comfort and pride bringing any of my family members to have any procedures here, surgery, clinical care. I think we have an outstanding crew, and they show it every day.
And you just touched on it. You've been at Winneshiek Medical Center for 2 years. Talk about your experience in this first 2 years on the job. What are some of the things you've taken away from your first couple of years on this in this particular position?
Yeah, so I would point to what I just said about just being incredibly impressed by the individuals and the caliber of people here. That would absolutely be number one. The second thing continues to be a lot of thought about that opportunity that we have to really be a regional hub for healthcare. And, you can kind of look at a map before you take a role like this and sort of get an idea of what that might look like or where patients may go for care. But once you actually get here, you talk to the people here, you find out where patients are coming from. We have a huge amount of individuals that live closer to Decorah. I think the number was 80 to 90,000 that live closer to Decorah than the next largest healthcare organization. And so, again, big part of our strategy is continue to grow our services. And we're going to be talking to communities that maybe we haven't historically talked to about who we are and what we do. So we're sending out our newsletter further than we have before. We'll be getting on radio and digital advertising out further. And we really want to become that regional hub for healthcare. And one of the other, I guess, big takeaways in my 2 years here is that we absolutely have an opportunity to do that and do that in many service lines and do it very soon. And so that has been a huge focus on us for us. We've done a lot in the growth realm. And as I mentioned before, we're far from done in that regard.
And in connection to that, a rebranding effort will start very soon. Tell us about that.
Yeah. So our launch week is looking at the week of June 5th. And that's when we will officially rebrand and start doing business as WinMed. So that'll be our new name. You'll see our new logo. Our tagline of excellence lives here is absolutely an appropriate tagline, I think, for everything we do each and every day. But that WinMed name was intended to, keep that county connection, the WINN, to that connection to Winneshiek County, but not spell out the Winneshiek name. I mean, we pull from more than just this county, for many service lines, and as mentioned, we hope to continue to pull from surrounding counties for many more in the future. So it's a good way to keep that nod to that county ownership, but also have a little bit more of an expansive name. So come that first week of June, or the week of June 5th, you will start to see some changes. You'll see the Montgomery street sign change. We have a couple other new signs that are on order that'll be coming in after that launch week. So there'll be a little bit of new look on our campus. And then rebranding efforts, they take a long time, and a lot needs to change. And so really we'll be working on our rebranding from, have been really for the last 6 months on through the end of this calendar year to get everything changed out. But we're excited to come out of the gates as WinMed here in early June, and hopefully staff and the community will be excited about that freshened up look.
Anything we're missing, Steve? Anything else you want to pass on to the public as long as you got the forum?
Yeah, I talked about our great success in recruitment. I would also add that we were fortunate to sign 2 board-certified emergency department physicians here recently. One that'll start with us here in the later summer, and another that'll be kind of mid next year. And so we're continuing to bolster those ranks. And then the other thing I would point to is just that we've been financially successful over the last couple of years, which is pretty unique in this industry. There are a lot of healthcare organizations that have struggled tremendously, and we absolutely have had cost pressures and have upcoming cost pressures that we'll need to figure out and address. But just to have a couple of really solid financial years, both with what's happening year to date this year, as well as the success that we had last year, again, is a little bit unique with what some others are dealing with. And I think is a good sign for our sustainability and our ability to continue to grow and serve this area.
On the cost end of things, how do you stay ahead of that? How do you have the vision to make sure that you're going to have what you need 6 months, a year, 2 years from now?
Yeah, so some of the cost pressures are absolutely inevitable with inflation. As I mentioned, recruitment and retention of staff is becoming more and more challenging, and so we are seeing wages rise as individuals continue to try to recruit the best and the brightest. And we absolutely are participating in that rising wage environment with what we're rolling out for staff increases here at the end of this month. So we certainly have cost pressures, and again, some of those are things that absolutely have to happen for us to retain the folks that we want to retain and recruit the folks that we want to recruit. Insurance companies don't typically pay more regardless of how much your inflation goes up. So your inflation on your overall cost might go up 8%, but that does not mean that insurance companies are going to pay 8% more. That's not how that game works. So we get modest increases. As a critical access hospital, we do get some cost-based reimbursement from our governmental payers, which helps us keep up to a certain extent. But then how do we make up that difference between revenues not rising greatly on a per case basis and our costs rising significantly? That is made up in growth. And that is why growth and continuing to offer more services and offer them locally continues to be our #1 strategy for financial sustainability. That is the only way to stay ahead of that curve. And so planning for our future growth is key for many reasons.
All right, Steve, we appreciate taking some time to tell us about everything going on at Winneshiek Medical Center here during National Hospital Week. Thanks for the time, as always, and thank you to and everybody at Winneshiek Medical Center for what you do to keep our community healthy.
All right, very good. Thank you, Darren. Appreciate it.
Steve Slessor from Winneshiek Medical Center. Hey, thank you to our 2 guests on the program this morning, the 2 hospital administrators from our immediate area, Micheal Coyle from Veterans Memorial Hospital in Waukon, and Steve Slessor from Winneshiek Medical Center in Decorah. I want to thank all those involved in the healthcare industry for National Hospital Week, and a thank you to all the nurses out there for National Nurses Week and everything they do to keep our communities as healthy as possible. Don't forget, we put these shows on YouTube each and every week. We realize you can't always be near a radio or a streaming device at 9 o'clock on a Thursday morning, but We feel we get the opportunity to talk to very interesting and compelling people, and we want to bring you those conversations on your schedule. If you're out and about on YouTube, enter 5/11 Our Town program, and you can find it there. We also put these links up on the Facebook pages of all of our LA Communications radio stations, Facebook pages, including 94.9 and 99.1 The River, Hawk Rock 100.5, Bluff Country 103.5 KNI, and Classic Hits 104.7 KVIK. Another way we connect with you at LA Communications. A thank you to our guest, a thank you to our sponsor, Decorah Bank and Trust, and most importantly, we thank you, that's right, you, for tuning in, for logging on, or for watching Our Town on 94.9 and 99.1 The River.